Parkinson's disease is a degenerative neurological condition, which means that it is a disease affecting the nervous system and it gradually gets worse as you grow older. Parkinson's disease has affected many well-known figures such as Michael J. Fox, Pope John Paul II, and Muhammad Ali. In Australia, there are about 100,000 people suffering from Parkinson's disease. This video aims to explain the causes, treatment, and impacts of Parkinson's disease in Australia. Parkinson's disease, due to its degenerative nature, usually occurs in people over the age of 50. However, younger people can develop the disease due to unfortunate circumstances. The symptoms of Parkinson's disease were first described in ancient Indian and Chinese texts. However, it was only officially discovered in 1817 by Dr. James Parkinson, who wrote about the disease in an essay on shaking palsy. Thus, fellow doctors christened the disease Parkinson's disease after its discoverer, James Parkinson. There are three outward symptoms of Parkinson's disease. The first is tremor, where the person can't stand still and will have difficulty performing everyday tasks. Other symptoms include stiffness, where the person is resistant to being passively moved, and slowness, where the person has trouble moving normally. So what triggers Parkinson's disease, and what is it that causes this tremor? To understand what causes Parkinson's disease, you have to look into the functioning of the nervous system. The part of the brain responsible for controlling movement is known as the basal ganglia. The basal ganglia monitors that movements are executed correctly. When the cells in the basal ganglia communicate, they use a hormone known as dopamine, which is a neurotransmitter. In Parkinson's disease, this stops being produced, and this causes all the abnormal movement associated with Parkinson's disease. Here is a PET scan of a brain with regular levels of dopamine in comparison to the brain of a person suffering from Parkinson's disease. Currently, scientists are not aware what causes this sudden drop in dopamine levels, but in rare cases, it can come from head trauma, strokes, or antipsychotic medications. Mild cases of Parkinson's disease can be treated with physiotherapy, but for worse cases, another form of treatment for Parkinson's disease is taking artificial dopamine. But this treatment only works for 3 to 5 years, after which time the effect can be completely unpredictable. But a revolutionary new technique was discovered in 1994 when a patient had an isolated stroke during brain surgery and began to recover. This treatment technique involves surgically placing neurostimulators connected to a pacemaker deep into the brain and blocking the electrical signals in the brain which cause abnormal movement. This pacemaker can then be remotely controlled to transmit what is known as a square pulse, which blocks the defective signal. But the main problem which arose with this treatment was to introduce the electrical lead deep into the brain without damaging the brain. The answer to this problem was a new type of computer-controlled surgery known as stereotactic surgery. This involves taking scans of the sections of the brain using a computer to calculate the path of the electrode into the brain. A frame attached to the head is able to accurately insert the electrode into the basal ganglia. Then, using electrophysical information from the patient, surgeons are able to insert the electrodes into the brain, causing minimal damage. The different thing about this treatment is that the patient has to be awake during the procedure, so the silver part of the electrode can relax the brain in the correct spot. Parkinson's disease will affect a large portion of the population, and 1 in 7 Australians will be diagnosed with Parkinson's disease before the age of 50. Parkinson's disease severely affects the sufferer's quality of life and often prevents them from doing everyday activities if left untreated. Parkinson's disease also has many impacts on society as it costs the Australian economy $527.8 million each year, as people with Parkinson's disease require much care. In conclusion, Parkinson's disease affects millions worldwide. However, treatments for Parkinson's disease are becoming more and more advanced as scientists discover more about the nervous system.